February is Heart Health Month. I am with Dr. Cundiff, a cardiologist at Lexington Medical Center, to learn a little bit more about how you can stay heart healthy and some of the incredible work that he is doing there. Thanks for being here.
Yeah, thank you for having me.
Okay, so first tell me a little bit about what you do as a cardiologist at LexMed.
So I'm a cardiologist, specifically electrophysiologist, so I specialize in the electrical system, arrhythmias, pacemakers, defibrillators, stuff like that.
Very cool. Heart disease is a huge deal. You know, people call it the silent killer. It's the leading cause of death in the United States. What is heart disease, and what can we do to sort of prevent that early on? Because I know it really affects a lot of older adults, right?
Yeah, it affects the young as well too. It encompasses a lot of different things. Congenital heart disease is structural abnormalities for babies or kids, problems with the heart valves, coronary artery disease, which is narrowing of the heart arteries, or heart attacks, and then arrhythmias. Arrhythmia is just a fast, irregular heartbeat that can either be benign or it can be more serious or dangerous, life-threatening, or somewhere in the middle like atrial fibrillation. Palpitations like feeling your heart racing or beating out of its chest, shortness of breath, fatigue, dizziness, occasionally chest pain or passing out. Depending on how serious your symptoms are, you can call 911, or if you're not feeling terribly awful, you can go see your doctor more electively and get an EKG to confirm the diagnosis. And then treatment options really depend. Atrial fibrillation can cause strokes. So if you have enough risk factors, you need to be on blood thinners to prevent strokes. And then depending on your severity or symptoms or how bad the symptoms are, we have techniques called ablations or medications to keep you out of atrial fibrillation.
Okay, and what are the small steps that we can be taking? Obviously that's kind of getting to the severe side of the negative side of that, but what are small things we can be doing maybe with diet, exercise, stress management to kind of, especially even when we're young, but especially when we're older, to make sure that we're keeping ourselves as heart healthy as possible?
Important heart healthy things would be diet, exercise, trying to exercise 30 minutes a day for at least 4 days a week, if not more. Eating healthy lifestyle choices, weight loss, avoiding excess alcohol, holding back on smoking if you do smoke. Checking your blood pressure regularly, I think, is another important thing that people often don't do because they don't have symptoms with high blood pressure. So,
yeah. And so for an adult, how often should they be getting checked for something like heart disease?
A lot of it depends on your risk factors. If you're overweight, older, have high blood pressure already, then you should be seeing a doctor at least every 6 months. Younger and healthier, no medical issues, once a year.
Doctor, thank you so much for coming in and explaining all of this. And y'all, we're going to have a little bit more information up on our website if you are interested in learning more about Lexington Medical Center and visit a cardiologist like Dr. Cundiff. Thank you so much.
Thank you for having me.